Commissioners, are there any questions about any items on the agenda for this meeting or for the meeting this afternoon at 5 o'clock? All right, well then let's plan, and are there any other items that folks would like to add to the agenda for our 3 p.m. meeting today during discussion? All right, then let's plan on following the agenda that we have published, and we're going to get started with our COVID-19 and vaccine updates, and Stacy Saunders is here to provide some updates. Thank you so much for being here.
Thank you all. So as of today, we have 15,970 confirmed COVID-19 cases that have been identified in Buncombe County. 294 COVID-19 related deaths have occurred in our community, and currently we are seeing roughly about 20 new cases per day enter our public health workflow. That's a decrease of almost 70% since the last time I came to present to you all. And our new cases per 100,000 per week as of today is 57. The Epi Curve is showing, after a short plateau that we talked about last time, what appears to be a slight dip again, and so you can see far less activity on our Epi Curve. Our percent positivity is stable. It is consistently below 5% for the last few weeks, and last week it remained between 2.8% and 3.1%. Today's value is 2.9%. The regional hospitalizations also continue to show some stabilization. Just as the Epi Curve in the last few days, there appears to be a very subtle dip, but much more of a flat line. And I think it's, wanted to, let me go, there was, I'm sorry, those were a little out of place. I apologize for that. I did want to share the COVID-like illness that we haven't looked at in a while because we've been focused on some other indicators, but I did want to show that the COVID-like illness, which is one of our early indicators, you can see the same type of trend that we saw with the Epi Curve, that we see marked decrease here. I think it's also interesting to note, though I didn't add it today, that the influenza-like illness surveillance report 2, what's really interesting with that data that DHHS captures in their surveillance report is that there's very little flu activity right now. And I wanted to highlight that and show that I think one of the contributing factors there are the precautions that we have in place for COVID-19 are impacting other viral transmission. So I'm going to go back one. Our local trends have fallen to levels consistent with before the surge. Our new cases per 100,000, and just a reminder that the table that you see here is pulled every Monday for you all, so it's from week to week. The new cases per 100,000 has fallen steadily over the last couple of weeks, and our percent positivity, as mentioned previously, remains stable over the last week, hovering around 3%. Our testing numbers have declined, but for comparison, our weekly average for the last few weeks has been 6,229. During the surge, this average was 9,676. Prior to the surge, the weekly average was 6,400, and compared to back in the summer when it was 5,334. So while current testing is less than what we were seeing in the surge, it is comparable to what we were seeing pre-surge and still higher than what we were seeing in the summer bump, if you'll remember. Seeing our trends come back into a more favorable area is welcomed, but it does worry me just a little that folks will see all this green and become complacent and forget that it is still very important to follow the 3 W's, that if we want to see these trends continue in this direction, that we cannot stop doing the things that matter right now as we continue vaccine rollout. So just want to make sure that I put it out there that for folks to continue to wear their masks, continue to stay 6 feet apart, continue to wash your hands, and limit your interactions with others. So I did want to mention also that we are starting to see the impact of a vaccine rollout in our new cases for those who are 65 years and older based on statewide data, that over the course of the surge and how it's come down, we have seen all age groups have a decline in new cases, but our over 65 population has seen that more rapidly and more pronounced. And we do believe that is the impact of that, those first rollout of vaccine, that we're seeing less and less of our 65-year-olds with new cases, which is wonderful to hear, as that was one of our groups with the highest risk of severe illness if they were to contract COVID-19. And on the state call today, they also mentioned that for long-term care facility cases, for long-term care facility clusters and outbreaks, we're also seeing that come down as well. So all good news that we do think is impacted by vaccine rollout. So while that is really great news, we are not seeing immense impact yet in the general population for vaccine rollout, because we're just starting more of that general population. So that's why, again, it's really important for folks to remember to practice the 3 W's so that we can continue to see our trends stay in this green area and hopefully reduce it even further. So please do not become complacent. And as a reminder, North Carolina is currently vaccinating groups 1, 2, and 3. And Group 4 will open first to adults with high-risk medical conditions, those experiencing homelessness, and the incarcerated on March 17th. That is tomorrow. Our wait list will go live tomorrow morning at 8 a.m. for this new group of folks who are eligible. I just wanted to give you a quick update too on our current wait list. Our wait list is considerably less than what it was just a few weeks ago. We were able to identify thousands of duplicates, and with our new unsubscribe function for the wait list, folks are able to remove themselves and still call us and remove them. We can remove them as well. That also resulted in thousands of folks coming off of the wait list. And so prior to entering into Group 3, this left about 16,000 individuals still on the wait list. And with the addition of Group 3, we added about 4,000 or so, give or take, individuals onto the list. So our team has continued to work the list down for appointment scheduling, and now we are scheduling in the 57,000 range for confirmation numbers. The highest number on the list is 65,557, and so just note that that does not indicate the total number on the list. That is the highest number for which we have assigned. And the total number of active individuals on the wait list is 14,676 as of this morning. So we are continuing to work that down as we now enter into Group 4 tomorrow. So as of yesterday, our state had administered over 3.1 million doses of vaccine, and this translates to almost 20% of the population receiving at least partial vaccination, and over 13% having now been fully vaccinated. And this is a slight change in language that I did want to bring to everyone's attention with the introduction of the Johnson & Johnson 1-dose vaccine. You might have remembered that it was first dose and second dose is the way we talked about it. Now with the introduction of a 1-dose vaccine, the state has changed their language to partially vaccinated and fully vaccinated, and we will do the same for our numbers so that we can compare apples to apples. So among all Buncombe County vaccine providers, over 83,000 total vaccines have been administered. This equates to 19.8% of our population achieving at least partial vaccination, and 12.2% achieving full vaccination. So for Buncombe County HHS, as a single provider and our partners at Emergency Services, we've administered 44,246 total vaccinations, and we have been tracking our equity work as a as a vaccine provider, and what you see here is specific to Buncombe County HHS efforts. And just to point out that we did separate this so that you can see the 65 to 74-year-olds and then the 75 and over. And what you're seeing here is the total population being a little over 239,000 based on the data we were using. And roughly 91% of that estimated to be white. When we look at the breakdown by age, we estimated that roughly 52,000 were white and 65 years and older. Breaking that down further for white and 65 to 74, we reached 33.2% of that estimated population, percent of white, and 75 years and older, 35.5%. And then with our African American Black population, about 6% of the total population, which is roughly about 15,000 individuals. When we looked at that age breakdown, percent African American and Black, 65 to 74 years receiving one dose, were almost 26% of that estimated population. And percent African American and Black, 75 years and older, also almost 26%. That is not a typo. The math really did come out to be the same. And then this has increased in just the last couple of weeks when I presented to you last, when it was about 22%. And our recent equity bump allocation has been used for the last couple of weeks to help engage and vaccinate our Latinx population who are eligible. And when we use the Office of State Budget and Management Demography estimates, there's not an age breakdown there. But we do have the total population information, which is roughly 10% of our population identifies as Latinx, which is a little over 23,000. And of that, we have percent Latinx receiving first dose is 3%. You might remember a couple weeks ago when I reported this, it was 1.4%. So our equity efforts we're seeing the dividends of that equity work. I didn't put it on the slide, but I did want to update you all on the long-term care facility work too, because I know that's been of great interest to you all. And that regarding the federal long-term care facility program, all the facilities that are in that program have received first and second visits, with many of them receiving their third visits, which will be their final visits. The state continues to track that progress on their state vaccination dashboard. Over 127,000 first doses have been administered through that program, and over 102,000 second doses have been completed. And this is indicative of about 80% of that allocation to that program. And locally, for those long-term care facilities that did not participate in the federal program, they were the responsibility of the local health department. 82 facilities were identified by the state for the responsibility of the local health department. 47 of those long-term care facilities have been completed. 16 have received their first doses. 18 declined or did not respond to Buncombe County HHS outreach. And additionally, our staff who were working on that project identified 26 additional facilities of congregate living, and that were not originally on that state list. 8 of those have been completed. 18 have received their first dose. And those congregate care facilities range from small family care homes to alternative family living homes. And they're usually smaller in bed size. And just to note, we're vaccinating both the staff and the residents of those. So we are currently working on opportunities to also vaccinate our homebound individuals in partnership with Meals on Wheels and Mission Care Medics. We'll be plugging into their existing routes to provide vaccine for those who wish to receive it, and so there's more to come on that as we continue to plan. And now on to vaccine allocation. We were expecting a new 3-week allocation notification last week, but then the state said we're going to extend it 1 week, so what we got the previous 3 weeks is what we got this week, which is current baseline of 2,340, which is still 2 trays of Pfizer. In addition to the baseline, we've received another 300 equity allocation, And just to remind you all, the intent of that allocation is to provide access in addition to your baseline to historically marginalized populations, which you've seen in previous presentations how we've done that. This week we'll continue to engage and vaccinate our Latinx population. In addition to these allocations, we did apply for a one-time special allocation of 1,170 to use for their school staff. This special allocation will allow us to finish our school staff list without taking away from our baseline. So we can apply all of our baseline to our wait list and those on there. And then North Carolina DHHS is expecting to send out the 3-week allocation for next week and the 2 weeks after today. I had not received it as I came into this meeting today, but we should receive it today and find out what we'll be getting for the next 3 weeks. I did just want to mention as well that we are in discussions with our hospital partner, HCA Mission, about vaccinating the homeless and incarcerated as we enter into Group 4. And the last thing I wanted to mention around allocation was that last week, in addition to our baseline and our equity allocation and a transfer from Mission of 1,000 doses of J&J, which we incorporated into our schedule, we received an unexpected allocation from North Carolina DHHS of 400 additional doses that we we had no idea that those were coming and had not scheduled those. So what we did decide to do with those is pilot our very first transfer to a provider. So you might remember we've been taking or accepting lots of transfers, but this time we got to pilot a transfer to another provider, and it went really well. We transferred to area pharmacies 200 doses to Health Ridge in Black Mountain, who has scheduled their appointments and successfully put their shots in arms, and then 100 doses each to Ingalls pharmacies, one in Weaverville and one in Leicester, so that we had some coverage around the county, and it went really well. So we're hopeful, based on the success of that transfer pilot, that if we were to find ourselves in that position again, that we'd be able to continue to transfer vaccine to other providers to increase the access throughout the community. We continue to administer most of our first doses at the AB Tech with outreach events for equity purposes, sometimes elsewhere. And we will be transitioning to the Biltmore Church South location on March 19th to begin use of that as our second dose site beginning March 20th. So we'll take 1 day to transfer everything over and begin doing our second dose vaccinations on March 20th. And just a reminder that we do have additional vaccine providers in our community. Hospital and local health departments were the first brought on, but then FQHCs and now some pharmacies and other groups are being brought on. And so folks can check out myspot.nc.gov to find a vaccine provider. And while we focus a lot on vaccine right now, I do want to remind folks that if you are experiencing symptoms or think that you have been exposed to COVID-19, it is best to get tested. Testing continues to help us reduce the spread, and testing is available at AB Tech on Sundays via StarMed, and more information on testing with StarMed can be found at starmed.care. And as we are in the month of the anniversary of many things, COVID, I did want to take a moment to recognize and acknowledge the leadership and sacrifice of our community in this year. I also wanted to acknowledge the hard work and long hours of not just HHS, but emergency management and all of our other COVID response partners in this last year. So thank you.
Thank you, Stacy. Commissioners, are there any questions?
I had a quick question, or maybe two. I guess first of all, is it your understanding that Mission Hospital is going to continue to get vaccines on a regular basis? And I guess where I'm going with that is, you mentioned the homeless population and the Johnson & Johnson vaccine. That seemed like the ideal vaccine to me for that population. And so I guess my question is around Mission Hospital and vaccinating our homeless population.
Yeah, so for populations that it might be harder for us to get for a second dose, we would prefer for Johnson & Johnson. I apologize, I keep calling it J&J, Johnson & Johnson. And that's what we're talking with our hospital partners with is when, if, and as they receive Johnson & Johnson through regular allocations or through special allocations, working with them to best use that Johnson & Johnson for our homeless population, our incarcerated population, because it does make good use of that vaccine in certain populations.
And Mission's going to continue to get shipments as far as we know?
As far as we know.
Okay.
Stacy, when you reported on one of the slides, the Buncombe numbers, separate from Buncombe DHHS, is that coming through the state site? Because we know people are leaving the county border to get the vaccine. So are we able to account for that?
We are able to account for that. So those numbers that you're seeing on that slide, and
Oh, just missed it.
apologies.
There it is.
Those are what we put into the CVMS system, and then we pull that report back out for our use. And when we stratify that by where their county of residence is or where their residence is, 94% is Buncombe County residents, 6% is outside of our county, with most of that being our surrounding counties. And I believe the last time we checked, less than 1% is out of state.
Thanks a bunch.
All right, any other questions? All right, Stacy, thank you so much. Okay, next up, commissioners, is an update on the rental assistance efforts, and Philip Harden is going to provide this update.
Good afternoon. Thanks. Wanted to give you an update of where we are with the COVID housing projects that we've been working on. And so, go ahead and go to the next slide, Max. This, a little history. This slide will kind of give you an idea of what we've done so far, starting almost a year ago. One Buncombe back in the timeline below that kind of tells you was generally April through early June. And we expended about $650,000 for direct assistance during that time. And then there was another allocation of one Buncombe that we used in January this year as a bridge dollars, and that was totaled up about $100,000. So really almost $750,000 through one Buncombe. And then we used coronavirus relief funds or COVID relief funds from mid-September through the end of December. And we expended right at $900,000. And then our current housing funding, we have CDBG dollars from the state that total $824,000. And then we have the emergency rental assistance program dollars from the feds, and that's just a little over $7 million. And then there's some affordable housing dollars that the county allocated to Eblin back probably about 4 months ago, I believe. And there's about $56,000 of those dollars left sitting at Eblin. So really a total of almost $8 million. And then with the most recent passage of the stimulus bill, there'll be another allocation of emergency rental assistance dollars. There was $21.6 billion set aside. And counties that have over 200,000 will be direct recipients of those dollars. So I should suspect that we will get another allocation of the Emergency Rental Assistance Program dollars. I've not seen what that allocation may look like yet. I was on a call with Treasury this morning. They said that their goal is to get that money out hopefully within 2 weeks. And so where we are right now with the Emergency Rental Assistance Program, we started taking inquiries and applications on March 1st. We're going to run the 2 programs, and now will be probably 3 programs concurrently. Right now, we're talking about emergency rental assistance and CDBG dollars running concurrently. The policies are similar, but there's some nuances in those dollars and who you can and can't help. So we are going to run those programs concurrently. Right now, we're still waiting on the state to release our CDBG dollars. We've submitted everything to them, waiting for them to set up an entrance interview so that they can release the dollars. So far, as of noon today, we've taken about 500 inquiries. I know on your slide it says 438. That was of last Thursday. Today we've taken about 500 inquiries, and we expended about $360,000 or approved about $360,000 already. We've probably not touched all those 500 inquiries, and what you'll see is those dollars expended because of the nature of this program and what you can and can't pay for and the amount of time you can pay for, that the expenditures are going to be much higher than what we saw in the previous housing programs. You know, you could be paying as much as 6 months worth of rent. So those expenditures will grow fairly quickly. Correct. With the emergency rental assistance dollars, it can go back to March of last year when the state of emergency was originally declared, and you can go prospective as long as you don't exceed 12 months worth of assistance.
12 months total is the maximum.
And there's actually a caveat in there that you could actually add another 3 months on that, but you would have to, for extenuating circumstances.
Okay. So for folks who might have lost their job because they were in a business that was impacted by COVID, they've been out of work, they weren't able to make rent payments, things like that, there's an opportunity for many people to catch up on all of that and potentially even pay some in the future. That's the nature of the potential support for folks who are behind on rent.
Yes, sir, exactly. You know, we've kind of looked at this to say we'll pay any arrears that exist to get people caught up to that point, and then look at prospective months to going forward. What happens is you have to redetermine eligibility every 3 months going forward. So, you know, we would have to re-verify eligibility and those things after 3 months.
Okay, great.
All right.
Now, do those payments go direct to the landlords or to the individuals?
The way the program is set up for emergency rental assistance, they go directly to the vendors or the providers, which would be landlords or
Right.
utility companies or such. There are exceptions with emergency rental assistance that we've not seen before. We'll talk about that in a minute. But there are some exceptions that you could possibly pay someone other than a provider. IT upgrades and communication plans. Our county IT did a fabulous job getting us up and running very quickly. They built a platform based on some other platforms we'd used. There's some reporting requirements back to Treasury. They built all those requirements into that platform. We're currently working with IT to develop an online application. We think that would be very helpful also. Right now, we're only taking applications by phone. But we want to put an online application out there, and also a dashboard to show, you know, amount of people who have been approved, dollars spent, demographic data, those kinds of things, because we're capturing all that data. But we wanted to get the platform up and running so we could take applications, and we knew there were some things we would work on later, and we're working on that currently. We have a meeting with County Communications this week to talk about our communications outreach plan and, how that will look going forward. We've kind of done a soft rollout. We wanted to make sure that our platform worked, that our process worked, and got that in place, and now we'll look to do that outreach.
And once we're online and we have the platforms going, are we still gonna take applications over the phone?
We will.
Okay,
We will take applications in many multiple ways.
good,
We
good.
want to make sure that there's a viable avenue for people to apply.
Good.
And even when we put an online application, we had one early on with one Buncombe, people still called.
Yeah.
The majority of our applications came via phone and not through an online portal. U.S. Treasury put out some new FAQs. The new administration put out new FAQs, and my understanding is there actually will be some more. So we went from 4 pages of rules to 7 so far.
Typical.
But there were some changes that I want to point out that I think that are important. The top one is the redirected, reduced timeline for payment. It used to be we had to wait for 21 days for landlords to respond to us and request for information about amount owed and those kinds of things. They reduced that to 14 days and gave us some other options.
Okay.
And back to Commissioner Whiteside's question about whether they go to the vendors or not, there could be situations where we can make a payment to an individual if we don't get a response from a landlord. So that would be a last resort. But it did cut down that timeline, which will help us tremendously.
Good.
They offered some flexibility around the documentation and now allow self-attestation as a last resort too. If you can't get viable documentation, you can take a client statement to some extent and attest to the validity of what they're telling you. But once again, that would be a last resort. And I think the one at the bottom is really important. They now allow what we call categorical eligibility. And us running this program, that helps. It means that if people are receiving food assistance and Medicaid, or those federal entitlement type programs or block grants, and we administer a lot of those already from an HHS standpoint, then we can determine their eligibility based on them already in receipt of, say, food assistance. And with casework staff who have access to that information, it makes it much easier. A lot of people, we may not even have to ask for documentation because we already may have those verifications and documentations to determine eligibility in our system. A couple other changes in the FAQs. Previously, under the old FAQs, if you were receiving any kind of subsidy for rent, federal subsidy for rent, even though maybe it didn't pay all of your rent, you weren't allowed to access these ERA dollars even for your own portion. That's changed now to where we can be able to help people who are already receiving subsidy and pay the client's portion of that. They now allow internet as part of that utility payment. It wasn't allowed in the first FAQs, but they now clarified to say internet access is a utility and we can pay that as part of paying utilities. Funds are now allowed for legal assistance, and they call that supportive services, and there's some questions about whether that comes out of administrative dollars or it comes out of your service dollars. But we'll work with Pisgah Legal around that. If we need to, we'll develop a contract with Pisgah Legal around, staving off evictions if they were to occur. And then the last piece is about the tribal lands. The tribes got their own direct allocations, and so they're running their program just like we are. And the next slide is a flyer that we're using right now, and I think y'all should have gotten a copy of this. This is kind of, we can use to do outreach with, and we'll put a web address on there once we get an online application. Right now it has our call center phone number on there. It gives you kind of the guidelines of eligibility. As far as income goes, it's 80% of the area median income. So for a family of one, it's a little over $40,000. For a family of four, it's a little over $57,000. Once again, all these programs, just a reminder, not being able to pay rent or your utilities has to be COVID related. So those things still exist in all these programs that we're running right now. You somehow have to tie it back to the pandemic for the not ability not to pay your rent or those kinds of things, like loss of job, reduced hours, those kinds of things.
And Philip, are you having any trouble with some folks who might have reduced hours or lost their job? They may not, like, maybe their employer didn't say this is happening because of COVID, but it did happen during that period. Is it difficult to document it in some cases, or do we give folks the benefit of the doubt that, look, if you lost hours or you lost your job during these periods of time, there's an assumption that it was COVID related?
Absolutely. We would listen to what that applicant told us, and then we would base it on what the applicant told us unless we could verify otherwise.
Okay.
Under the previous housing programs we ran, it was, especially with the CRF dollars, it was kind of really strict about what was COVID related and what's not. There's a lot of flexibility built from U.S. Treasury, and I really believe that that's intentional, not to put a lot of rules out there so that you can build that into your local policy. And I've heard that on a couple calls with them so far. So we built those kinds of things into our local policies so that we cover ourselves and that we can be as flexible as possible as determining what's COVID related and what's not.
Great.
Any other questions?
I guess my only other question is, this is a lot of resources. We're still early in this process. So is it too early to tell whether or not, even though this is a large pool of funding, whether this is highly likely to get fully depleted over the coming months based on the folks? We know that there's thousands of people who have lost jobs or lost wages compared to where we were 12 months ago as an economy. So is there any sense of this is probably going to cover the need, or even this amount of money, once the word is fully out in the community and people apply, this is likely to be all drawn down this year?
My assumption would be yes, I think we'll spend the dollars. There actually are some more dollars still sitting at the state that we could access also, probably around about $2 million that the state set aside for the direct allocation counties and cities, that if we expended that, say, the $7 million that we have now, we could access those dollars also. But looking at the payments and the number of people we've served already, if you kind of do the math in your head, I mean, we've probably not approved more than 50 people or so far, and to expend $360,000, it'll go fast.
Okay. Great. All right, Philip, thank you so much for these updates. We appreciate it.
Thank you.
All right, next up, Rachel Nygaard is going to give an update on the United for Youth Network.
Good afternoon, Commissioners. Rachel Nygaard, Strategic Partnerships Director for Buncombe County. Presenting to you this afternoon as part of the briefing in advance of coming back to you next month with a decision item related to joining the Asheville-Buncombe United for Youth Network. When I come back on April 20th during your regular meeting, I'll be co-presenting with the folks you see in the back row, Laura Elliott and Joseph Jameson, who are with United Way. And in that more complete presentation, we'll cover in more detail some of the why, looking at some of the data and information related to opportunity gap and achievement gap, and looking at the linkages in terms of how it connects with the commitments this board has already agreed to with the strategic plan, Buncombe 2025. But for today, what I want to do is introduce what the United for Youth Network is and what it would mean for Buncombe County to sign on, so that over the next month, you've got time to ask questions and dig in, either connect with me, connect with the folks from United Way, or others who have been involved in the collaboration so far. So what is United for Youth Network? This is a collaboration across organizations and across sectors. What you see on the screen and in front of you was co-developed by more than 150 voices, including youth, student, family, educator voices, and voices from community partners like Buncombe County. The idea being to establish that equity and educational excellence are inseparable, working toward a vision where all children and youth learn, grow, and thrive in a vibrant and healthy and connected community. And all of this is tied together with, under the banner of a bold community goal, which you see on the screen here. The bold community goal being what all of the partners within the United for Youth Network are agreeing to work toward through this collective action model. The goal being that by 2035, all Asheville City and Buncombe County students graduate from high school ready and fully prepared to pursue their goals and dreams. When we present more detail, you'll see the way that we've defined what ready means, and we'll talk more about the data that will be used as a background for that. But partnership is something that we wanted to highlight today. United Way of Asheville and Buncombe County is providing the coordination and the facilitation of this collaborative, and it truly reflects a multi-sector partnership. There are about 75 organizations so far. You'll see the names of a few here on the screen of what might be sort of the early adopters. You've got the school systems, other local governments like City of Asheville, nonprofit and community-based organizations. All of these folks will be coming together through their own processes, their own governing boards, to go through the official sign-on process this spring and through the summer, working toward a more official community launch of United for Youth Network in the summer by August, when we're ready to start the new school year. So what does it mean to commit to the network? The first item on the list is sort of a philosophical commitment to center leadership from youth, from parents and families and community. And that aligns well with the commitment that we've made within our own strategic plan, within our comprehensive planning approach, within our racial equity planning, where Buncombe County is really saying that the voices of people most impacted are critical to our decision-making. And so having community engagement and community leadership central within the process is definitely a theme. Another theme I see with the United for Youth Network is the foundation on data. You'll see results-based accountability, data and evaluation practices here. The idea is coming together on a shared commitment for what data we're going to measure, how we'll tell what success looks like, what our goals will be, how often we'll measure our progress, where we'll report it, and what we'll do about the data that we see. Not independently as Buncombe County and City of Asheville and Buncombe County Schools and Asheville City Schools and all of those different players, but collectively as a network. Another commitment here you see on the screen is called the Early Warning and Response System. So for those of us that don't spend day in and day out in the school setting, I'll explain what it is. It's essentially a platform that pulls together information about student attendance, student behavior, grades on core courses, together with the other kinds of data that we think about academics, like the end-of-year EOGs, end-of-grade assessments. And that data is provided at real time to the hands of educators, after-school leaders, principals, other decision makers within the system so that they can provide custom integrated supports for students when they, as soon as they see indicators that a student needs success. So this is a platform called Early Warning and Response System. I wanted to include on the next slide some examples of what integrated student supports means, because that's a pretty kind of broad or vague category of things. So what would this really look like? How would it play out in a classroom or in a school over the course of a year? So there's 4 categories of what this looks like, but a student support might be accessing service at a school-based health center that's being established at one of the local schools. It might mean accessing behavioral or mental health counseling. There's examples of what authentic and active family and community engagement look like. You might have heard of homework diners. That's a strategy that's evidence-based and is looking to be replicated. A parent leadership program. There are opportunities around mentoring and tutoring and other out-of-school time programming. And that cross-sector leadership, which is really where Buncombe County fits in a lot of ways, participating in the school-based resource teams and engaging that youth and family leadership. So what does this mean for us as a member of the network who's a county government? There are a few commitments that you'll see in our partnership agreement when you see the draft. One of them is to participate in the cross-sector leadership team. One of the members of your board, Jasmine Beach-Ferraro, does participate in that leadership team, as does our elected sheriff for Buncombe County. Sheriff Miller participates in that, and I participate in that leadership team. There are also teams for network convenings. We've got engagement of county staff who interact with families and students, like social workers or sheriff's deputies who participate in those, as well as the school-based resource teams. The results-based accountability work, that shared data evaluation platform, our participation in that from Buncombe County is through our data department, our performance management department. Our other commitments that you see listed on the screen are to align our initiatives that we're undertaking as part of Buncombe 2025 and our commitment to education with the initiatives of that network. That plays out, for example, when we brainstorm about how can the libraries connect or the parks and recreation connect better with the efforts that are happening within the schools. And then the last 2 bullets are sort of things that we do day in and day out as a stakeholder for education. One is to deliver services, those core services that we offer and operate through Health and Human Services, through our Affordable Housing Services Committee, through our public safety and justice initiatives that really support a vibrant community that can help whole child and whole families to be healthy and thrive, because we know that education and opportunity happens at the community level and not only in the schools. And finally, Buncombe County as a stakeholder is a funder for education at the early learning level, K-12, community college, and then through our educational support initiatives like you see popping up through our grant programs, for example. So that's a summary of what the initial commitments look like. We'll be back on April 20th. Between now and then, I would invite you to reach out to me if you have any questions, to Commissioner Beach-Ferrara or Sheriff Miller or Laura and Joseph, and any of us would be happy to talk with you, share more information about the why, the data that's causing us to move in this direction, and the what these solutions look like. So with that, I will conclude the presentation and ask if there are any questions or comments.
I don't have a question, but just briefly want to thank Laura and Joseph and all your colleagues. This is a very inspiring project, and I've been honored to get to learn about it as it's been built out, and just think that the community schools model offers such exciting opportunities for us as a community to collaborate in ways that have been challenging in the past, and also to tackle the many issues we know exist in the lives of children, including the opportunity achievement gap, with the degree of resources and integration that we need. And it's very exciting to think about what's possible in the years ahead with this lifting off, with the work towards the expansion and movement towards universal pre-K, and thinking about the potential bridges and continuum that can exist for children from the earliest days of their lives through the K-12 experience, and what that means. So I'm so inspired and really excited to talk with other commissioners, but mostly listen and hear thoughts and prepare for our next conversation about this.
This sounds good, it's great, but how much is it gonna cost us?
Would you like me to attempt that?
I mean,
So we've had a lot of discussions with United Way as we go through this sign-on process about how is this what we already do, and how is this something that's bold action and something new. In many ways, it's a infusion of how we work together as opposed to taking on something new. This is not a program or an initiative with a price tag. We already partner with our early educators, with our K-12 educators. We already deliver those supportive health services and justice services, and being a part of the network is really just how we do that differently, particularly for us on that data side, that we've got performance management. We already committed we were going to select some measures and do work measuring educational success, and if we can tie together and do that data work in unison rather than independently, we feel like we can get more leverage. So there's not a price tag. At the same time, the education function is somewhere around 30% of the entire general fund budget for Buncombe County in any year. So education is one of our biggest commitments and our biggest investments already.
I'm glad to hear you say that. And I hope as we plan for this and work into it, seeing that we already in all these organizations put money into this now, I hope we can look at it and work smarter rather than more money. You know, sometimes we throw a lot of money at it, we never get out what we put in. But I hope by collaborating and all, we can get a bigger bang for our buck.
Understood.
All right, Rachel, thank you very much.
Thank you,
Appreciate it. I
Chairman.
look forward to discussing
Thanks,
further.
yeah.
Next up is a discussion of the continuation of capital contract with Buncombe County Schools. Michael Free will present this item.
Mr. Chairman, Commissioners, good afternoon. Michael Frew here. I had asked for Tim Fearley to swing by today, but I don't believe he's been able to make it. This started about September last year, or at least the financial aspects of it, when the Buncombe County Schools came before the School Capital Fund Commission and requested funding for the safety and security of their schools. They recommended, and this board approved in October last year on a budget amendment, about $660,000 to make studies of the 47 Buncombe County school campuses. So that process is moving forward, and at this time, the Buncombe County schools are wishing to enter into a continuing contract for capital outlay pursuant to statute 115C441 for the design and construction management services of the project. So that's important because any school unit is required to get the approval of the commissioners funding the projects for projects that cannot be completed within one fiscal year. So that's a continuing project. So what the board asks is that we bring to our April 6th board meeting for your consideration a resolution asking for such funding, and that funding would be like in 3 pots. So it'd be grants or funds not required to be approved by this board, conventional appropriations through the School Capital Fund Commission process and or the yearly capital outlay budgeting, and in some circumstances, maybe limited obligations bonds for the largest of those projects. It's important to point out that with 47 campuses, the school board understands that this cannot be done in 1 year. It may not be able to be done in 3 or 4 years. It might be 10 years. It's going to take a lot of time, and besides just think of, this is like entryway improvements to make them safer for the students and faculty. So this approval does not mean that the county is ceding its role in controlling the funding of any larger project. So the resolution that would come before the board would indicate that it's for a project per project outlay that it would have to be completed within more than one fiscal year. So I'll try to answer any questions without Mr. Fearley, but I think some of these projects might be fairly inexpensive. I think on average, they might be in the neighborhood of $750,000.
Okay. So there's going to be a resolution written up on this, and it'll be on the regular meeting agenda at some point in the near
Yes, sir, in 2 weeks, and that will be a resolution authorizing continuing capital contracts for construction of certain security upgrades at Buncombe County Schools.
And these are for projects that we've already approved funding for. These are for the security projects that we've already approved funding for.
Yeah, the projects themselves have been approved, but this is specifically construction agreements to, each of the 47 projects will live on its own and be its own project. So it'll be 47 contracts essentially with Novus Architects and Harper Construction.
Okay. Sounds good. If Tim happens to show up before we adjourn, if he wants to say anything else, we'll hear it from him. But otherwise, we'll talk more about it when it's on our regular agenda.
And I'll
So-
flag them for a few weeks from now. Yes, sir.
Okay, sounds great. Thank you, Mr.
Thanks.
Fruth. All right, the last item on our agenda is discussion about public comment at our commissioner meetings. And this is an item I asked our staff to look at a couple of weeks ago, as we are, hopefully in the later stages of this COVID pandemic, and as the vaccination process is rolling out, and we're looking ahead towards a time when hopefully we're beyond this, that we have a process to restore the in-person public comments at our commission meetings. So I asked the staff to think about what a process might look like as we're not completely beyond COVID, still want to be really safe, what that kind of interim process might look like. So Ms. Pender, would you like to share a few thoughts on this? And then I just thought we'd have kind of an open discussion as a commission about these ideas and the timing for when we might want to move into this kind of phase.
Sure, and I did provide that memo to you, you have at your place right now. Our thought would be that typically there's about 15 staff members, including the board, at our meetings. So if we were to comply with the governor's 25 indoor mass gatherings, we could reserve up to 10 seats for the public to attend. If there's any overflow, we would utilize our conference room down the hall, the one that we currently use for closed session. And we could have up to 9 people in that classroom, in that conference room right now. So we would stagger it so that there's no more than 25 in here at any given time. Staff would wait in their offices or in an adjacent conference room, and they would come in and go as their items are called. The thought here would be that masks would be mandated unless that is something that is changed in the future, and social distance would be required. So there'll be stacking in the hallways. You see the tape is already there. There'll be one way in and one way out. So we would make sure the protocols are in place. We would recommend that we would wait till the governor, this specific order is lifted. He comes back again on March 26th. We would recommend waiting for that before we would start this. So this could start as early as your next meeting in April or anytime thereafter.
Okay. Are there any questions? Let's first just talk about the basic idea, and then we could talk about what, potential timing. So first, let's kind of talk about regardless of the exact timing, does this sound like a good approach? Or are there any comments or questions or concerns about the process outlined here?
I think I'm generally supportive. I guess one question off the top of my head is just the math in terms of when we have visitors to present to us, like I'm thinking of the facility study folks. It seemed like there was 5 people here, and 10 minus 5, you start running out of seats for the public, and so it just kind of, it's a tiny window, I guess, is my comment.
That's the reading, it's up to 10. If there's
Yeah.
visitors that we need to film, we can say less than 10 today. You'll wait in the waiting room until those visitors finish their presentation,
Okay,
and they would leave, and then we would free those seats up.
okay. Kind of make people wait and they come and go, okay.
Correct.
Yeah.
Okay. And with the people who are here for public comment, of course, we have public comment at the beginning, toward the beginning of our meetings, and then we have public hearings. So if people want to stay for a public hearing, then they would continue to be here until that comes up on the agenda. For folks who just want to make some general comment, they would do that and then would be asked to leave after they make their comments during public comment. Am I thinking about that in the same way that staff are?
Well, we were not going to ask them to leave. It is their alternative. If they want to stay or leave, we will make that announcement that public comment is over. Thank you. If you want to stay, you can stay, but we were not planning on asking them to leave.
I kind of, and I'm not trying to be rude, but I kind of think we should. Because we're going to ask our own staff to leave too, right? Like, you need to come into this room and participate for what you're here to do, and then depart. So I don't know that we can require it, because someone might not be sure if they're going to comment during public hearing. They might, but I'd like to, in a diplomatic way, maybe say, if you're not planning to make additional public comments, then we'd ask you to leave after that, just to, keep as much social distancing as we can within the chambers, which, can last many hours. So other questions or just thoughts, commissioners, about this?
So I'm glad that we're looking at moving towards this. I think we're one of the few, in the research that I quickly did, one of the few county governments that have continued to meet in person over the last year. It seems like a lot of the counties that are our size have moved to a virtual format and are still in that format. So I think we're ahead of it. I came in generally supportive and still am. However, I think we need to figure out that rotation of people coming in and out, and maybe it's we continue having them sign up so we know who's coming and what to expect. But I don't necessarily feel comfortable with just continuing to stay in one place. Yeah, but I am glad that we're looking at it and being ahead of the curve and looking at how we re-engage our constituents and citizens of Buncombe County.
On the sign-up question, that's an interesting point. So right now, we're requiring folks to kind of sign up to be on the call-in list, right? So could we do something like that? And if folks, so we'd say, here's our public comment,
Yeah.
here's our public hearings, and then we could say, if you haven't signed up to participate in the public hearings comments, then we ask you to depart after the general public comment, right? Because at that point, they're just basically an observer in the room, right? If they're not planning to participate during additional public comment. And I think most people would get that.
And I'd be freeing up a seat for someone that wants to watch another piece. Yeah, yeah,
Mhm.
that's the goal, yeah.
Any other kind of thoughts just on the protocol? You said there's one way in, one way out. How would that work?
Well, no, we do have the stacking and the arrows now on the ground, so they can
Oh,
come in
okay,
and then they
yeah.
can go back out. So they don't always have to cross.
Okay, but they're still coming in and out of the entrance hallway over
Yes,
here.
where the sheriff deputies are set up, and then
Okay.
they can go out the other way.
Okay. Let's talk about the timing a little bit. So our next meeting is in 3 weeks from now, because there's an extra Tuesday in March. Obviously, a lot of the metrics that Stacey Saunders was talking about are looking much
Going
better.
down, Yeah.
I guess just for myself, I would maybe want to take a little bit more time, not have the next meeting, not have this go into effect at the next meeting, but maybe talk about it further then if the numbers are still looking really good or better and the vaccination numbers are continuing to build out, that maybe that second meeting in April, perhaps we could have it go into effect at that meeting. So that's kind of my initial thoughts. Other suggestions? Yeah, let's talking about the idea here, checking again about it at our next meeting, and if things are looking really favorable, then we could, as a board, decide to go ahead and put this into an effect for the second board meeting in April.
So I would say that, so I'm supportive with the staff suggestion in proceeding, and I think it's a very good idea. My one question I did want to ask, when you mentioned where we go into closed session, if we have a closed session, we have an alternative of where we'll be able to utilize if you have public in there?
We do. We have the room next door that could hold more, or we have an old closed session room that is a little bit tighter.
Okay.
So my option would be that we would use the room right next door here.
Yeah.
So I'm supportive, and I'm fine with beginning to proceed whenever everyone else is comfortable. I'm fine with proceeding now, but whatever everyone else chooses.
Excuse me, just ask a question, just in general. The 10 people that would be in here, that be reserved for the public, is this to observe the meeting, or is just for public commenters?
I was envisioning it that you have to sign up for public comment. So again, you know, I don't think, I mean, if something happens and they don't comment, I don't know what the, you know, ramifications of that would be, but the expectation is that, no, you're here to participate in in-person public comment, not just be an observer in the meeting. There'll be a day when we're back into that, and this is all completely opened up again, but for now, I think what we're, in this interim step, we're inviting people who want to make a comment to the board to have the opportunity to do that in person. So it would be, you'd have to sign up for public comment to do that.
And I agree, you know, now we're in the pandemic. This is not the time to come in just to observe. They can do it, you know, online or whatever, but I really think the only ones we need in here are the people for public comment. I agree.
And if I could, Mr. Chairman, my couple thoughts are, from my perspective legally, what we really want to strive for is a reasonable accommodation. So I think that goes directly to the chair's point and Commissioner Whiteside's point, that if you limit it to 10 at a time, you limit it to sign in, and then ask them politely to leave, then you're making a reasonable accommodation for public
Right.
input for those hearings. So just two other thoughts. If we're waiting for March 26th to do this, then at that point, yes, it is probably too late to make sure we have all our ducks in a row for the clerk's records to go out and to make sure the public knows, and to have notices that would have to go out consistent with the new process. And also, if we're concerned about rotating people, the board might consider moving public comment to after the opening original comment, general public comment, then keep it more packed and just rotate people more quickly.
I'm sorry, I want to make sure I understand that idea of, can you say that last part again?
I was trying to look for a copy of the agenda, but
Public comment now is after the consent agenda, so it's early within the meeting. So are you saying prior?
Yeah.
in my mind, I didn't really see it, but I think you're right. Consent agenda, then public comment, but make sure that it comes before county manager's report or
Right.
any other presentation.
And for clarity, could we keep like the online registration for public comment that we do, but they would actually just come here? We would just have an online portion where they sign up for public comment, or we would allow individuals to come in and sign up for public comment as they come in?
Yeah.
Yeah, when I suggested that, that was what I was
Okay,
thinking, that you
just
would still
trying-
keep
just-
your process that you
Just
have
trying to
in
get
place.
clarity. We
Yeah.
can, if that's the case, we can
Online.
kind of change up
Mhm.
what some of our wording with the sign up for the
Mhm.
registration, but we can keep the kind of public comment registration the same. And one other thing, would we like to go to still have public comment where they can call in and have the in-person, or are we talking about one or the other?
I think we should do one or the other. I think they're both good, but I think we should do one or the other, my
I was-
personal
I
take.
disagree there. I agree with where we're headed generally, but I do think preserving the ability for people to call in is important, especially for people who might be in high-risk groups and for whom this
Mhm.
doesn't
Right.
feel as medically safe.
Right. And
So
we
that
may,
would be where I'd land on initial reflection.
I agree. And we may have people too, I mean, we are still in the middle of a pandemic, who may be isolating and
Right.
quarantining, but still want to participate in public comment. So to me, this just opens it up a little bit further. But again, that goes to the point of signing up, then we still know who's coming and
Who's
who's gonna
gonna
call in.
call in?
Yeah.
Sorry, I keep hammering on that
Yeah.
one, Mark.
I've seen another jurisdiction has opened it up for limited public comment as we're discussing, and they're allowing people to continue, or please go ahead and send in any email. We won't read them all, but we'll post them to the public comment
Yeah.
page. I mean,
And we're not going to read them anymore. We did that for a while. Okay, other thoughts? I mean, I totally get the point there. I mean, my inclination might be to then just keep it online a little bit longer, if we're, would be my personal take. But any other thoughts on this?
If staff can figure out a way to accommodate both, that seems like the best way to accommodate not putting an arbitrary cap on the quantity of public comments, which we can't do, so.
Well, and make sure I'm kind of understanding the idea right. If more than 10 people wanted to show up in person and do public comment, we would keep taking public comment. It's just that as folks have made their comments, then they leave, and there's
Right.
more space available. So if 20 people wanted to
Right.
do that, then the first 10 people need to be rotating out of the building to make space for the other folks, right?
Correct.
Okay, well, why don't we plan on putting this on the regular agenda at the next meeting in April? And then in that way, if we want to go ahead and vote as a board to move into a different policy, then we can be prepared to do that. If we want to take more time, we can always choose to take more time as well. But let's have it on the regular meeting agenda so we can be prepared to actually make a decision if we want to.
Would you like us to add some trigger points? I was thinking if our numbers stay up where they are in the dark green for positivity, we could think about moving forward. If they go the other way, we can pull back. So,
Sure, I mean, I don't know, I would definitely, I think that's what we would want to be looking at, right? Is like, everything's really green, the whole variant concerns are not sending us in the other direction or raising concerns about having more people. So yeah, I think we would definitely, as part of that presentation, we'd want to get we're going to get an update that day already on trends, but just any kind of additional information that might inform that whether or not we're ready to do this in a safe way at that time. So that'd be great. All right, commissioners, we have gotten through everything on our agenda, so.
I've got one here.
Go ahead.
Just sit and listen to all the options, and, I would like to do one or the other, but I understand, maybe we're not quite ready for that yet. But, and I don't know if we can do it or not, but could we change public comment to say 4:45 before any of our staff is in here, and we could accommodate all 10 of them? 'Cause we don't answer any questions. We're here to listen to that and then start our meeting at 5 o'clock. And then could use the public, or them calling in at our regular 5:15.
Okay, so the suggestions actually start a little bit earlier, don't have staff present, because we're just going to take public comment.
Right.
And do that at that time, get that completed, and then begin the regular meeting once so it's actually like the first thing that we would do.
At 4:45, or would it have to be at 5 o'clock because?
There'd just be some, procedural requirements that change the meeting time, but you wouldn't have to do anything except change the agenda order to do that at 5 o'clock.
Also, I think we need to keep in mind on how the briefings are running and running into some of the regular meetings, and sometimes, just keep that in mind. We would have to make sure that we shorten some of the briefings or not long briefings at certain times.
And the reason why I said that is, our COVID update used to be 45 minutes to an hour, and the last two today was 19 minutes. So we are seeing that we're not over going to 5 o'clock now. We're having, we got 40 minutes now before the meeting starts, so.
The one concern we've had in the past, and I still hear this, I know people talk about city council and other meetings, is you move it earlier, the working people might say, that might be a problem. And that's why a lot even complain about 5 o'clock, saying it's early. But that's the only thing I would see, people who might.
If we moved the public comment to before the consent agenda, then the staff, a lot of times we have staff sitting out here, even though they're not planning on saying anything, they're there just in case a commissioner has a question related to a consent agenda item that they would be the one to answer. So if we did the public comment before them, we still start at 5, take public comment, and then those folks would mostly depart who are not going to speak later at a public hearing, and then our staff could come in after that. So I think we could take the concept, but still just start at 5 o'clock and try to sequence the public versus the staff out that way.
And then just continue on, anyone who wants to call in
Right.
will speak after the ones in person, if you're going to go with both.
And I guess too, it's also contingent, just keep in mind too, I know I'm just throwing out, keep in mind, but it's also dependent upon how many public commenters we have too. So if we have a hot topic and we have more than, let's say, 10 public commenters that want to start the meeting, then the meeting may not start on time, or we just have to keep that in mind. Because we don't know what the hot button item is going to be or who's going to be here for public comment at that time. So I just want to keep that in mind.
Just out of curiosity, how many people are signed up for public comment tonight
13 at this point.
for everything?
Yes. There are only general public comments. There are no people signed up for the public hearing for the rezoning.
Oh, it's for the.
All right. All right, well, Commissioners, we are going to talk about this again at our next regular meeting and possibly make a decision about making a change at that time, or just hold on to what we're doing now and keep monitoring it until we feel ready to move on to this concept or something similar to it. We are adjourned until our regular meeting at 4 o'clock.